If your back pain reliably disappears for a few weeks and then comes back, you are not experiencing recovery with occasional setbacks. You are caught in a cycle, and cycles have specific mechanisms that can be identified and broken. The recurring back pain cycle follows a pattern so consistent that experienced physiotherapists can often describe a patient's next 6 months of pain history before they have finished the initial examination. Something triggers a flare: a long drive, a heavy carry, a day of more physical activity than usual, sometimes nothing that feels significant at all. The pain intensifies, you reduce your activity, rest for a week or two, perhaps take some anti-inflammatory medication, and the pain settles back to a manageable baseline. You return to normal life, and within days, sometimes within hours, the cycle is beginning again. If you have been through this pattern 3 or more times, the pain has almost certainly become self-perpetuating through a mechanism that now operates independently of whatever initially started it. Here is what that mechanism looks like at the tissue level. Every time you rest to recover from a flare, the deep stabilizing muscles of the lumbar spine, the multifidus, and the transverse abdominis undergo measurable deconditioning. They lose a small increment of strength, endurance, and activation timing, precision during each rest period. When you return to your normal activity level, those muscles are slightly less capable than they were before the flare. The joints and discs they are supposed to protect are exposed to slightly more unmanaged load than before. The tissue irritation from the next trigger is slightly more intense and slightly more persistent than last time. The threshold, the amount of activity required to produce the next flare, drops a little lower with each cycle. Over months and years, this process produces what is clinically called central sensitization. The pain processing system in the central nervous system becomes recalibrated toward generating pain responses more readily and more intensely than it should. At that stage, the pain is no longer only about the condition of the tissue. It is also about a sensitized processing system that is amplifying every signal coming from that region. This is why long-term recurring pain often feels disproportionate to anything a scan can explain. The scan shows the tissue, it cannot show the sensitized system processing it. Breaking the cycle requires addressing several things simultaneously rather than sequentially. The structural drivers first, the specific muscle imbalances, movement dysfunctions, joint restrictions, and accumulated deconditioning that have built up across all the cycles. Load management. Second, identifying what triggers your flares, modifying the ones that can be reduced, and systematically building your body's capacity to handle the unavoidable daily loads that cannot be reduced. The nervous system component. Third, education about the biology of chronic pain, graded re-exposure to movements that have been avoided, and rebuilding confidence that the spine is structurally competent. A physiotherapy assessment for recurring back pain examines all 3 dimensions, not just the current flare, but the entire history and pattern behind it. This is why treating just the current episode without examining the underlying pattern is the most common reason recurring pain keeps recurring despite apparently appropriate treatment. There are also things you can do right now between flares that genuinely interrupt the cycle at its foundation. Move consistently every single day, even when you feel less than perfect, because the evidence on recurring back pain is unambiguous. People who maintain daily moderate movement have both less frequent and less severe recurrences than those who only move when fully pain-free. Avoid both counterproductive extremes, complete rest, and pushing hard through significant pain. The specific exercises that help break the cycle are not complicated, but they need to be matched to your actual deficits rather than applied generically. Deep lumbar stabilizer reactivation, the pelvic tilt, dead bug, bird dog progression, addresses the deconditioning of the multifidus and transverse abdominis. All 3 need to be in the program simultaneously, because addressing only one while the others continue is why so many individually well-designed treatment courses produce disappointing results. If you have not had a comprehensive physiotherapy assessment that examines your full movement pattern and complete history, not just the current episode, that is the single most valuable step available to you. The link in the description takes you to the full back pain guide with detailed information on the physiotherapy approach to recurring pain.